Is there a way to regenerate cartilage or meniscus in the knee? It was a comment I got in another video, and I want to answer that today. I'm Dr. John Tait. I'm a non-surgical orthopedic doc specializing in regenerative medicine, where I use some fancier new modern techniques in my practice, not the old 1960s cortisone injections that do help pain but definitely do bad things to your knee. So let's just park on that for a minute and talk about that. So there was a study in 2015 done at Stanford, pretty reputable institution and group of docs, that they wanted to see what is the actual physiologic effect when we put cortisone intra-articular, which means if we take a knee like this, intra-articular means inside the articulation of the joint. So they took steroid and they put it in the joint. Well, in this study, they were really using mice, and then they were using dishes in the lab with cartilage cells, which we call chondrocytes. And the goal of the experiment was to see if we dose up enough cartilage or enough cortisone into the cartilage or into the joint where the cartilage is, what happens to the cartilage. Lo and behold, what they found out is when you exceed a certain dose concentration of corticosteroid, or what we commonly refer to in jargon just cortisone, it kills the cartilage cells. It is toxic to the chondrocytes. So again, I'll post this in the notes. We'll put a blurb up here about that article if you want to read it in its entirety. But it's very interesting because that was 2015. And what we see 10 years later is there's still a lot of corticosteroid injections being done to knees. Okay, so to answer Kathy's question, is there a way to regenerate cartilage and meniscus tissue in the knee? Well, the first aim would be don't do things that degenerate it. Okay, so cortisone is the #1 degenerator of a knee. And if you're having that injected into the knee repetitively, well, this very cartilage that we want to preserve at all costs, like in this model, this cap on the end of the bone is the articular cartilage, the meniscus, what Kathy was asking about there, this flexible cartilage inside the knee. If you keep pounding steroid into there, you're just going to degenerate that tissue further. It doesn't allow the body to heal. It does shut off inflammation. So you feel better and you have this illusion of, well, I'm getting better because I don't hurt as much, but the hurt in the early stage is triggering a chain reaction of events that is actually needed for the tissue to heal. So think about that. If you hurt and you walk into an office and they say, hey, do you hurt and you want steroid? And you say, absolutely, I don't want to hurt. And they drop it in there, that's what it's doing to your knee. And are you being completely consented for that to say, hey, you know, if we drop 40 or 80 milligrams in this, it's toxic? Or, hey, do you know the lethal dose of cortisone in your knee for those cartilage cells that we want to preserve is maybe 8 milligrams? And they want to give 4 to 5 to 10 times that. So I don't know about you, but I don't want 4 to 5 or 10 times the lethal dose of anything put in my body, let alone my knee joint, when I'm trying to preserve that cartilage at all costs. So if we move over to, hey, don't do dumb things to the knee, meaning put repetitive doses of steroid in there, this is some of the dumb stuff we're still doing in healthcare in 2024, when we've known since 2015, and that's not the only article that's been published about this. So we kind of get around this topic of what's covered in medicine and why is it covered. That's maybe a healthcare rant for another day. But what you're learning today is that's not a wise thing to put in the knee if your goal is keep your knee, keep the cartilage intact. So let's move over to the things that actually can shape some healing in the knee, because that's what I like to do in my practice. That's the focus of my specialty in regenerative medicine. The things that we've been using there for a long, long time, and I'm talking back to 1990s. If we want to go back even further, there's treatments in the 1950s people were using, namely dextrose and lidocaine, to stimulate a purposeful inflammation in the tissue that triggers your body's cells to be attracted to that area to stimulate healing. In the 1990s, we started using a treatment called platelet therapy, or PRP. It stands for platelet-rich plasma. And the concept behind that was borrowed from facial, cosmetic surgery, dental surgery, and also a lot from veterinary medicine, where they were using this for years to treat racehorses and other things, so other animals. But they would take platelets, which is a fraction of the cells within your bloodstream, and those platelets hold growth factors. So if you've injured yourself, you've cut your skin, platelets are activated in that mechanism to heal the tissue. So think about this internally in the knee. You just can't see it, but the mechanism's the same. So your body's dripping these cells there to stimulate that healing. So all along a knee joint, there's a vascular network, meaning blood vessels are traversing by the knee joint and small capillaries are going into the tissue network like the meniscus and the ligaments. The cartilage cap, it's fed from underneath with that the blood vessel and capillary supply. But what we're pushing through that capillary supply is the nutrients the tissue needs to heal. We're also returning waste products out of the tissue that need to be removed so that the tissue can heal. So getting back around that platelet concept, if we inject platelets in there, or when we do that, because I do this quite often in my practice, we stimulate this healing mechanism. We just augment the natural healing of your body. It's the same mechanism, we're just elevating it, amplifying it, resupplying the area that needs more of those growth factors to stimulate healing. And then as time went on, we started using stem cells. So stem cells, if I find a model here, if you look inside a bone here and we go through the shell and you see the spongier bone, and inside there's bone marrow. And inside that bone marrow, there are stem cells. So in the big bones of our body, we have stem cells, reservoirs of these, and we can tap into that. So I most commonly use the back of the hip bone, ilium, to do this. And we can extract stem cells that have even more powerful growth factors than PRP. So now we can take stem cells in combination with PRP. We can embed these into the joint or the injured structures, whether it's a ligament, or Kathy's question was about the meniscus or the cartilage. In her case, it sounds like she was trying to preserve the cartilage, maybe not wanting to go down the slope towards a joint replacement or other surgery. And this is where, it depends on the injury. So you have to see a qualified individual to say, does this stuff even make sense? Is surgery really the best route for you? We got to have that early decision tree to say, hey, you're not a surgical candidate for some reason, or surgery is not warranted here. And if you've tried the conventional things, the old rice method or the meat method or all these other methods to just heal conservatively without interventions, and say 6 weeks, 8 weeks, 12 weeks, or for some people, 12 years have gone by that they've suffered with an injury before they see me. If we can take these cells very easily, which we can, from your bloodstream, from your bone marrow, and we can inject them into the knee with a simple procedure, we can really augment that healing. Then we can really see what your body does for itself for the next 2 to 3 months. So there is a time interval. I mean, it's not magic pixie dust. You have to give it some time. Once we inject it, the body goes to work healing that tissue, and then we see if we choreograph the rest of the steps with rehab, movement correction, performance correction for the activities you're doing. That's all the stuff we can do in that healing time so that you come back a better athlete, whether you're a pro athlete, amateur athlete, or just a weekend warrior. I mean, same rules apply. You're going to need some time and space and good rehab, but we can accelerate that time frame to heal using some of these. So these are amazing tools that I use every day, every week in my practice with patients that are looking for other answers outside of surgery, or they've tried all the other DIY versions on their own and just haven't had the success. So hopefully this helps answer your question, Kathy, and hopefully it answers the question for other people like Kathy that are having knee issues, thinking about what can I do for this cartilage or meniscus. If you want more content like this, subscribe to the channel. We'll be talking a lot about non-surgical things because that's what I am, a non-surgical orthopedic doc. We're talking a lot about regenerative medicine and these new, modern tools that we have in my practice that can augment healing. So when you feel like your body's default is degeneration, we can get it thinking like its actual default, which is regeneration. So if you have any comments on this, drop them below. If we can help you in any way, there's a link in the notes below the video here, and that will take you over to a page on my website where you can talk with one of the smiling, happy people in my office that interview patients and dig into your case and see if we're a good fit for what we do. And hey, if we're not, we got a vast resource of people, both regionally and nationally, some of the best surgeons to get you to. If it comes to a place where you need surgery, because I'm not a surgeon, we'll get you to the best person in our network that's matched to the situation you have.